My topic is the causes and effects of allergies and asthma. The purpose is to inform the audience on the causes and effects of allergies and asthma. 7.8% of people 18 years and older are affected with hay fever. There are 10 to 30% worldwide affected by allergic rhinitis, In 2012, there was 17.6 million adults diagnosed, and 6.6 million children diagnosed with hay fever. Almost 25 million Americans affected by asthma, 8% being adults and 9% being children. What are allergies and what is asthma? Asthma is a disease that causes the airways of the lungs to swell and narrow. This leads to wheezing, shortness of breath, chest tightness, and coughing. This is a long-term disease requiring medication. The airways in the lungs are tubes that carry air in and out of the lungs. And when those airways become narrow, when those airways are inflamed, they become narrow, making it harder to breathe. Allergies is a disorder of the immune system. And allergies and asthma are related to one another. And people usually with allergies usually have asthma. Becoming allergic is hereditary. It can come from one parent or both parents. Me and my daughter, we suffer from allergies, and my daughter, she has asthma, and we have a hard time with that. We cough a lot, and have itchy eyes, and have a lot of colds and sinus infections, and we have to take a lot of medications. She has to take Singulair, Zyrtec, and Xopenex, and Pulmicort, and I have to take Zyrtec, sometimes a series of immunotherapy shots. There are types of asthma: allergic asthma, cough variant asthma, occupational asthma, nocturnal asthma, and other health conditions that cause asthma. Allergic asthma is most common with those who have allergic rhinitis, with constant runny nose, sneezing, swollen nasal passages, excess mucus, weepy eyes, and a scratchy throat. Coughing is a result of postnasal drip. Cough variant asthma. Coughing is severe and is the predominant symptom. Coughing from chronic sinuses is common with asthma. This type of asthma is often underdiagnosed and undertreated. This can come from respiratory infections and exercise. Occupational asthma is a type of asthma that results from your workplace. Symptoms include runny nose, congestion, eye and irritation, have cough instead of your typical wheezing. These symptoms usually occur only while you're working and during the day, and they usually subside when you leave the area. Nocturnal asthma is also called nighttime asthma. Symptoms flare up during sleep hours because of increased exposure to asthma triggers, cooling of the airways, heartburn, sinuses, and coughing. This can be dangerous because you're asleep, but sometimes you can wake up when you start having difficulty breathing. Most deaths related to asthma occur at night. There are other health conditions that can also cause asthma. Excuse me. And these health conditions can mimic asthma. And one of them is cardiac asthma. It is a form of heart failure that can mimic asthma symptoms. Another kind is a vocal cord dysfunction. It is sometimes misdiagnosed as asthma because of the wheezing. People who have the vocal cord dysfunction wheeze, but it is not asthma. There are types of allergies. There's food allergies, seasonal allergies, pet allergies, and many others. Food allergies and food intolerances, such as milk, eggs, peanuts, fish, or shellfish. Seasonal allergies affect many people like me and my daughter. Spring.
I'm sorry.
I'm sorry, but that's my daughter and she's helping me out. Spring and fall are the worst because of trees and weeds and grass. On breezy days, pollen count can be higher because it is picked up in the wind and it carries it through the air. Rainy days make it lower because it's been washed away. Other allergens include dust, mold, and mites, which occur in the winter time, ragweed in the fall, and pollen in the spring. There are medications that can control seasonal allergies, and they are antihistamine, decongestant, nasal sprays, and eye drops, and in cases like mine, immunotherapy or allergy shots. I also suffer from pet allergies. Dander gets everywhere. Not only are people allergic to the dander, which is flakes of dead skin, but also saliva and urine. Other allergies include hay fever, also known as allergic rhinitis, poison oak, ivy, sumac, insect stings, aspirin or penicillin, cosmetic allergies, nickel allergies, and those treatments for asthma include avoiding asthma triggers, medication, monitoring daily asthma symptoms. Drugs used to treat asthma include bronchodilators, anti-inflammatories, and leukotriene modifiers. Bronchodilators relax the muscle bands that tighten around the airway, letting more air in and out of the lungs to improve breathing. Anti-inflammatories include inhaled corticosteroids such as Pulmicort, Qvar, Flovent. They reduce swelling and mucus production in the airways. They lead to fewer symptoms, better airflow, less sensitive airways, less damage, and fewer episodes of asthma attacks. Leukotriene modifiers include Singulair, to name a few. They work by limiting reactions, improving airflow, and reducing asthma symptoms. There is no cure for asthma or allergies, but can be treated and controlled. If treated and controlled, people can live symptom-free.
Sorry.